Food safety is a critical concern for everyone who dines out, yet many don't realize just how often restaurants face health violations, and Dutchess County is no exception. Last month, 56 health inspections were carried out across the county, revealing a mixed picture. 22 establishments passed with flying colors, 14 were flagged for critical violations that demand immediate attention, and 30 still had unresolved issues from previous inspections. But here's where it gets controversial. Should we be alarmed by these numbers, or is this just the reality of running a busy food service operation? To put things in perspective, New York State is home to over 90,000 food service venues, ranging from bustling restaurants to school cafeterias and nursing home kitchens, all of which undergo regular health inspections. These inspections are designed to ensure that food is prepared and served safely, protecting the public from potential foodborne illnesses. If you're curious about the health records of your favorite spots, you can explore detailed inspection reports for New York State eateries at data.poughkeepsiejournal.com. Let's take a closer look at some Dutchess County restaurants that struggled the most with health code compliance last month. Remember, critical violations are serious issues that must be fixed immediately because they pose a direct risk to food safety. While non-critical violations, though less urgent, still need to be addressed within a set time frame. For example, Salsa Fresca Mexican Grill in LaGrange was inspected on September 2, 2025, and recorded 9 violations, 4 critical and 5 non-critical. Meanwhile, Beacon Bread Company in Beacon had 6 violations, including 2 critical ones, during its September 3 inspection. Other establishments like Le Petit Bistro and Momiji Hibachi Sushi Bar in Rhinebeck each had 6 non-critical violations, but no critical ones, indicating issues that, while not immediately dangerous, could affect overall cleanliness or operations. Some places faced a mix of critical and non-critical problems. Day Night Lounge in Wappingers Falls had 4 critical and 2 non-critical violations, while Jersey Mike's in the same town reported 3 critical and 2 non-critical issues. On the other hand, Fishkill Creamery in Golden Walk had only non-critical violations, suggesting their food safety practices were generally sound but could improve in areas like maintenance or cleanliness. Conversely, several Dutchess County eateries achieved perfect scores with 0 violations during their inspections. These include KD Deli in Poughkeepsie, Round 3 Restaurant in Amenia, Taro's Pizza and Willa in Millerton, and others like the Poughkeepsie Day School Commissary and Buns Burgers Eastdale. These spotless reports reflect a strong commitment to food safety and hygiene, which is reassuring for customers. But what exactly distinguishes a critical violation from a non-critical one? According to the New York State Department of Health, critical violations involve serious risks such as improper food sourcing, unsafe cooking or storage temperatures, poor sanitary practices by food handlers, contamination from pests, or the use of toxic substances. These issues can directly lead to foodborne illnesses and must be corrected immediately during the inspection. Non-critical violations, often marked in blue, don't pose an immediate health threat, but relate to factors like the cleanliness of the facility, maintenance of equipment, or the design of the kitchen. While these don't cause food poisoning directly, neglecting them can degrade the overall safety and quality of the food service environment over time. Interestingly, New York State does not grade restaurants on a simple pass or fail basis. Instead, inspectors note violations and require corrections based on their severity and urgency. How often do these inspections happen? It depends on the risk level of the establishment. High-risk venues, such as full-service restaurants, diners, and school kitchens that handle complex food preparation like reheating or cooling, are inspected twice a year. Medium-risk places, like pizzerias or sandwich shops, that serve simpler foods, get inspected once annually. Low-risk establishments, including bars and coffee shops where food preparation is minimal, are checked every 2 years. All county health inspectors receive standardized training from the New York State Department of Health to ensure consistency in inspections across the state. If you want to learn more about your county's health department, visit health.ny.gov/environmental/water-drinking/cty-add1.htm. What if you suspect a restaurant isn't meeting health standards? you can report your concerns directly to the Dutchess County Health Department. They take complaints seriously and will send an inspector to investigate. To file a report, visit https://www.health.ny.gov/environmental/foodsafety.complaints.htm. This report is part of a broader effort by the USA Today network to provide localized health inspection data across the country, using information gathered from local health departments. We welcome your feedback or corrections to help improve our coverage. Please share your thoughts here. https://www.health.com. Gannett-nxuao.formstack.com/forms-a-feedback/platform tangent desktop/https:/www.poughkeepsiejournal.com/story/local/2025/09/16/monthly restaurant inspections/861. And here's a question to leave you with. Should health inspections be more transparent and frequent to better protect consumers? Or do current practices strike the right balance between safety and practicality? Share your thoughts and experiences in the comments below. This story was crafted by Ozge Terzioglu.